Today, we're going to talk about the Patient Protection and Affordable Care Act. In the United States, the cost of healthcare has been steadily on the rise, reaching over 15% of the gross domestic product by 2010. This cost is expected to reach 20% of the GDP by 2025. Additionally, 23% of Americans were uninsured in 2010. These statistics demonstrate that there was a significant opportunity for improvement within the United States healthcare system. The Institute for Healthcare Improvement announced the Triple Aim Initiative in 2008, which included quality care, health improvement, and cost reduction. For many decades, health policies had been proposed in Congress to make healthcare more accessible and affordable, but all attempts had failed due to partisan issues. In 2010, major healthcare reform made it successfully through Congress and was passed during the Obama administration. This was the Patient Protection and Affordable Care Act, or ACA. The main goals of this policy mimic the Triple Aim: expansion of insurance coverage, cost control, and improvement of healthcare delivery. While access to care includes many factors such as physical location of healthcare resources and health literacy, this policy focused on the access to healthcare barrier of having insurance. The ACA included multiple major points of reform, several of which worked to increase the number of Americans with some form of health insurance coverage. These included expansion of Medicaid and the Children's Health Insurance Program, increasing the age of dependent coverage to 26, mandating individuals to obtain insurance, mandating employers to provide insurance options, and creation of a federal exchange to allow for purchase of insurance for individuals who did not qualify for coverage through any other options. The ACA also implemented changes to insurance companies to reduce limitations that could previously be placed on individuals to obtain health insurance. These included removal of the ability to deny individuals coverage based on pre-existing conditions, elimination of lifetime limits on coverage, creation of tiered plans that were standardized across all companies, and requirements of insurance to fully cover preventative services. The ACA had a significant impact on the number of insured Americans. The number of uninsured peaked at 46.5 million in 2010. After the passage of the ACA, the number of uninsured went down to 26.7 million. Once bill changes began to be implemented, the number of uninsured slowly began to increase, up to 27.5 million in 2021. It is difficult to pinpoint how each individual change affected the number of insured or healthcare outcomes, as they all work together for these goals. For example, 50 million Americans have at least one pre-existing condition that would previously have affected their ability to obtain insurance. However, evidence showed that not all Americans provided eligibility for insurance had obtained coverage. When looking at insurance status of individuals seen at a free clinic, many were eligible but faced access barriers beyond eligibility, such as health literacy. The ACA has faced continuous challenges and criticism since it was enacted in 2010. The Trump administration made several attempts to repeal and ended up passing several revisions to the original act, and changes started to be seen after 2016. One of these was the ability of short-term plans to be offered, which were not required to comply with ACA policies. This allowed them to deny individuals coverage based on pre-existing conditions and not cover preventative services. These plans worked against the principle of cost sharing by reducing the lower risk individuals in the pool and creating a group with higher healthcare costs and therefore higher insurance premiums and deductibles. Another change made was the removal of funding for cost reductions that made certain plans within the federal exchange more affordable, which was done because the funding source was unavailable. This impacted silver plans, which resulted in a change of many Americans to either gold or bronze plans instead. Additionally, the individual mandate to purchase health insurance was removed in 2017. While repeal of the ACA was not successful, these bill reforms undid much of the work of the original ACA.
What are exchanges and how are different states approaching them? With the approval for Medicaid expansion came the ability for each state to choose to accept those expansions or not. The purpose of healthcare exchanges was to increase competition among insurance carriers and offering a greater choice for consumers. States were now allowed to permit their businesses who employed up to 100 employees or more than 100 employees to purchase coverage in the SHOP exchange. The role in the exchange by state is to create an American Health Benefit Exchange and a small business health options program exchange for individuals and small businesses, and provide oversight of health plans and enroll newly eligible Medicaid beneficiaries into the Medicaid program. If needed, a state can be exempt from the maintenance of effort requirement if the states certify that it is experiencing a budget deficit or will experience a deficit in the following year. These exchanges are optional, so not all states will choose to participate. SHOP Exchange qualifications. In order to participate in the SHOP Exchange program, there were qualifications to be met. Eligible individuals were required to be U.S. citizens or legal immigrants who were not incarcerated. Multi-state plans had to be offered, and one of these plans was required to provide abortion coverage compatible with the state and federal laws. Since these laws have changed in the last year, this would mean less or no coverage for this medical care depending on the state. Each plan was required to be licensed in each state and required to provide adequate provider networks and to be accredited. What does the Medicaid program have to do with the ACA? Many reform efforts were not successfully implemented or have been overturned after implementation of other administrations. For example, President Trump sought to overturn the ACA implemented by President Obama. The debate over healthcare reform led to the proposal of the American Health Care Act in 2017, which was meant to replace the ACA. This act would repeal the provisions of the ACA that allowed for the expansion of Medicaid enrollment, which would leave millions of people uninsured if the AHCA was passed into law. Congress and the Trump administration were successful in reversing some of the coverage gains of the ACA, but failed in 2017 in the attempted overturn of the ACA, and the Medicaid expansion remains intact. The change to the ACA that did pass was the tax reform bill that would increase insurance premiums. This is known as the Tax and Jobs Cuts Act. Although the ACA is still currently in effect as law, many of its original promises made in the law in 2010 are no longer in effect. The founding of Medicare and Medicaid back in 1965 was the biggest and most successful healthcare reform efforts to date until the passing of the ACA due to its patient protections outlined in the bill. By expanding the eligibility of Medicaid gives the potential of pointing this country closer towards a universal healthcare system by making it so a larger part of the population has protected access to healthcare. Unfortunately, though, the attempts to repeal the ACA and the changes made to it, many of the promises in the ACA are no longer being fulfilled, which presents the healthcare system with many current challenges since the Trump administration and in today in 2023. How have health insurance premiums been affected? Premium subsidies are available to persons with incomes at or below 400% of the federal poverty level, and to ensure that buyers spend no more than a fixed percentage of their income on health insurance. The amount of the subsidy is based on the cost of a moderately generous plan in a person's local insurance market. In 2016, it was ruled by a federal judge that the government could not help plans with the cost of providing assistance with cost-sharing premiums. The ruling did not relieve insurers of the obligation to offer this more generous coverage according to the law.
Variables, the impact of the Affordable Care Act. Employer-based insurance coverage depends on knowing when to renew the coverage plan and picking an affordable plan. State-based insurance coverage plans are dependent on knowing when the redetermination date of coverage is to submit an application for renewal of benefits. 11% of people experience gaps in healthcare coverage, which can be related to loss of employment or changing jobs. This can cause a lapse in coverage. Those coverage gaps can average a year or longer, which can impact health outcomes for persons with chronic health issues. The ACA closed healthcare coverage gaps by the establishment of the insurance market reform and made coverage equitable for all persons with pre-existing illness. Overall, studies have shown that persons with healthcare coverage, whether it is private or a state plan, have better access to healthcare services, and there have been a decrease in unmet needs, reducing health disparities in various populations, reducing the number of uninsured. The expansions of the ACA increase access to healthcare coverage for low-income persons, which reduced persons not receiving healthcare coverage because of cost. Premium assistance contributed to the decrease of young adults that were uninsured. The factors that contribute to individuals being underinsured are out-of-pocket costs that are equal to 10% or more of the household income, 5% or more of the household income for persons living under the federal poverty line, and lastly, the deductible is 5% or more of the household income. The out-of-pocket costs can be unaffordable if cost-sharing fees such as co-payments, deductibles, or uncovered services are high. Medical debt can occur because of gaps in insurance, being underinsured, having individual cost-sharing fees, or receiving a surprise bill from treatment from an out-of-network provider. In January 2022, the No Surprise Act was established to prevent medical debt for care provided. Healthcare insurance coverage increases the ability to receive healthcare services. Key challenges, state and national policymakers. Over the most recent years, barriers that contribute to the ACA's implementation nationally and on a state level were delayed due to changes in the political party, with the Republican Party having the majority control of political seats. There was a shift in implementing needed extensions and changes of the healthcare reform. The states were given the provision to establish marketplaces and expand Medicaid specific to population needs and geographic area. But many states declined to design specific marketplaces and instead used the federal guidelines. The political parties contributed to the continual debate of law and passage of the ACA healthcare reform implementation and changes due to objections centered around concerns of the effects of healthcare costs rising. The political parties played a role in moving forward with Medicaid expansions with a consistent argument that marketplaces had flaws, and there was opposition that the Republican Party was against the individual insurance mandate. The Trump administration sought out to change the federal standards and guidelines previously that governed the ACA healthcare Medicaid expansion. The proposal to have states submit a waiver for approval that would allow each state the leadway to pilot changes that would permit tougher conditions, making the ability to qualify for Medicaid more difficult, decreasing the access to care for those who need it. There were several proposals submitted by Trump administration to repeal or replace many of the federal regulations that govern the ACA, such as expanding short-term limited durance insurance, loosening the regulation that governs health plans, changing the requirements to qualify for health benefits, modification of the wording of the ACA that would protect beneficiaries from discrimination, and the proposal of the administration not defending or intervening in any new constitutional changes that would arise. The repeal and replace to healthcare reform was denied for several reasons, such as the proposed changes would increase healthcare premiums, decrease access to beneficiaries, would allow discrimination, making healthcare not equitable, and it would remove the individual insurance mandate. It will also not protect ACA from any constitutional changes that would be proposed. ACA, good or bad law? The Affordable Care Act was a healthcare initiative that aimed at reforming healthcare. The ACA has had its accomplishments and its shortcomings. The accomplishments are increased access to affordable healthcare. It significantly reduced the number of uninsured persons. It increased health equity, had positive health outcomes, established preventive health care, reduced health disparities in low-income marginalized communities, and prohibited discrimination for all persons. The shortcomings are that there are 11 states that have restrictive guidelines to qualify for Medicaid, and those states refuse to implement a Medicaid expansion, which caused a healthcare gap for populations in those states. It also contributes to low enrollment and low contribution of premiums that decrease the overall financial projections. Healthcare is not being provided to those persons that cannot afford private insurance, and are not considered in the poor low income bracket to qualify for Medicaid. Is the ACA a good or bad law? There are documented successes that the established law has made significant improvement in healthcare delivery system. However, the shortcomings have been the cost to the federal government due to low enrollment and low premiums.
The ACA has changed in many aspects since the ending of the Obama administration. The Trump administration made attempts to repeal it, ultimately being unsuccessful in doing so completely, but was able to change the tax law that would fund a portion of the Medicaid expansion plans. Much of the original ACA's provisions are currently not being enforced. Presently, the U.S. healthcare system poses many challenges regarding healthcare reform. There is constant tension and ongoing debates about how to approach healthcare reform between conservative, libertarian, and liberal views of differing political parties who have competing interests. This is why healthcare reform seeking patient protection in this country is so difficult. In conclusion, the U.S. healthcare system considers the triple aim approach to healthcare reform and overall patient protection of rights, services, and coverage. The goal of the triple aim is to make decisions that contribute to an increase in patients' access to healthcare, making it affordable, and ensuring that patients receive adequate care that is high quality. There is still remaining tension today regarding the future of the U.S. healthcare system. Healthcare has a long way to go regarding patient protection. The remaining implementation of the ACA in the future is unknown.